As we all are aware that last year we had a lot of mortality in commercial broilers and commercial layer growers because of hepatitis and nephritis cases with hepatitis and nephritis cases. In field, many a times these gross lesions in birds are confused with lesions produced by mycotoxins and are similar to lesions produced by fowl adenoviruses. Of course, people, they used to vaccinate the breeders as well as commercial broilers with IBH vaccine. And in spite of vaccinations, they had such kind of lesions. So people, they used to think that might be new IBH or adenovirus serotype maybe getting evolved. But the conditions are not like that. Because last year we had severe shortage of feed ingredients, and because of high prices of ingredients, people, they used to they are using the substandard feed ingredients, and because of this this has resulted in the uses of the mold infested feed to the birds. And so taking into consideration all these factors, before going to the clinicopathology of FADV, I am presenting overview of mycotoxicosis. So mycotoxins are naturally occurring toxins produced by certain fungi, and the group of several hundreds of chemically different toxic compounds exist, and more than 3,000 mycotoxins are harmful to the humans and animals. And common mycotoxins are aflatoxins, ochratoxin A, trichothecins, zearalenone, and fumonisin. And minimal tolerable levels are different for different mycotoxins in poultry. There are various factors that affect the bird's susceptibility to toxins, maybe species, strain, age and sex, nutritional and health status, type of and concentration of mycotoxin, other toxic entities, and duration of exposure. And all are aware that young chickens are more sensitive to toxins than older ones. If you see the maize scenario of India, particularly in Kharif season, Kharif harvesting is done in hot and humid climate, and generally maize is harvested at 20 to 25% of moisture, and afterwards they are drying it. So at that time, particularly the mold infestation is more, and you can get more toxin formation in badly harvested maize. So the toxin can be formed in pre-harvest in the field, post-harvest storage, transportation, feed mills, feed bins or on farms, residual or caked feed in feeder, and spilled feed in litter. There are many species of fungi which produces different vaccines like cyclopiazonic acid, aflatoxins, citrinine, ochratoxin, trichothecins, T2 toxin, DAS, DON, zearalenone, and fumonisin. So what will happen if low mycotoxin contamination will be there in feed for long duration? Then particularly because of immunosuppression, there is increased susceptibility to viral and bacterial infections, poor response to vaccinations, excessive use of antibiotics, and the end result is uneven growth and poor performance of the birds. But when high mycotoxin contamination is there, in addition to immunosuppression, there will be visible symptoms in target organs, clinical manifestations. Along with clinical manifestations, there will be mortality in birds. There are limits of mycotoxins defined for poultry. So aflatoxin B1. So these labels, of course, are not specific and may cause toxicity at lower levels also if multiple toxins are present. So if we take global mycotoxin occurrence, various agencies has carried out surveys in different regions in different periods, and this paper is about from 2008 to 2017. They concluded aflatoxin B1 is of highest, which is prominent, and they followed by fumonisin, ochratoxins, DON, zerlenon, and T2. Again, Cargill has done one mycotoxin survey from May 20 to April 21, and conclusion of their survey is raw ingredients were highly contaminated with aflatoxin, and average contamination level was 45 ppb, which is much higher than risk level of aflatoxin in poultry. Fumonisin is also prevalent in India with average level of 2983 ppb, which is much higher. Again, DSM World Mycotoxin Survey in 2022 has shown that South Asia region are at extreme risk with highest mycotoxin prevalence, that is 93%, and the aflatoxin, ochratoxin, T2 toxin prevalence was on higher side. And also more than one mycotoxin has been present in the tested sample survey. So they have also shown that finished feed, aflatoxin was detected in 42% of finished feed with a maximum level of 243 ppb, and 95% of corn samples were contaminated with fumonisin with average 2828 ppb. So we have also tested mycotoxins in various periods. This is the data of 2019, and if you see this, particularly August, September, October, November, and December, higher levels of aflatoxin, more than 20 ppb, has been found. Almost 80.85% samples were having more than 20 ppb aflatoxin B. Here, positive samples, you can see this green bars. These are aflatoxin having low aflatoxin levels less than 20%, and this yellow having more than 20 ppb, and this is ochratoxin is less than 40 ppb, and T2 toxin less than 150 ppb. But the samples which are positive in aflatoxin, ochratoxin, then T2 toxin. So multiple toxins are there, and they are responsible for the immunosuppression in birds. This is regarding fumonisin testing. In fumonisin testing, 30 to 40% samples showed higher levels of fumonisin than permissible limits. It's very alarming. So even there is one paper regarding hepatotoxic effect of fumonisin, and he concluded that the dose-dependent hepatotoxicity effect is observed grossly and histopathologically in birds. So fumonisin B1 is hepatotoxic in nature and cause so how the diagnosis of mycotoxicosis is done? It is based on the toxic effects, based on the mortality, pathological and histopathological lesions, biochemical parameters and immunotoxic effects, rough estimation by gross lesions on visceral organs, and then physicochemical methods, TLC, HPLC, mass chromatography, gas chromatography, and immunochemical methods like ELISA and rapid test kits. So these are the lesions, particularly in aflatoxin. So liver and kidney lesions, again kidney lesions. Here the gizzard lesions particularly, you can see in the kaolin layer and hemorrhages. These are ovarian lesions, lot of hemorrhages. This is commercial broilers 5 days. This is 12 days commercial broilers. These are again 27 days.